Casper, I'm going to show you how to save your pet's life with CPR. As a pet owner, would you know what to do if your pet stopped breathing and had no pulse? I'm a vet nurse and I'm going to walk you through it step by step. The first thing that you will do is stimulate your pet. So touching them, calling their name, seeing if they are responsive. If they are not responsive, I want you to remember A, B and C. So A is for airways. Is their neck extended? Do they have anything obvious in their mouth obstructing their airway? So you can open their mouth and have a little look inside. If there is something obvious and you can remove it, then do so, but don't risk pushing the object further down their throat. Presuming the neck is extended and the airway is clear, then I want you to move on to B. And B is for breathing. Is the animal breathing? To check this, you can either just watch and see whether or not their chest is rising and falling, or lower your head down towards their head, place your cheek in front of their nose, making sure you don't get bitten. Your cheek is extra sensitive, so if they are breathing, you are likely to be able to feel it. It is more sensitive than the palm of your hand. With your head down here, you can also visualise the chest and see whether or not it is rising and falling with a breath. You can also place your hand on top to see if you can feel any movement. Next, you want to move on to C, and C stands for circulation. This means, has the animal got a pulse? One of the easiest ways to check this is using the animal's femoral artery. Now this is on the inside of their back leg. So take 2 fingers and put those 2 fingers on the inside of the back leg and you should be able to feel a pulse. The other place that you can use is on the chest, so directly over the animal's heart. If you pull their leg backwards, where their elbow lands, that is where their heart is. Now, presuming the neck is extended and there's nothing obstructing the airway, there is no breathing and there is no pulse. This is when you would move on to CPR. Now the first steps to remember, lay the animal on their right hand side. You want their left hand side up top. If you are physically unable to move the animal and they can only lay the other way, that's fine. Any CPR is better than none. I also want you to remember that if you are at home and the animal is on a soft surface like a couch or a bed, you want to move them onto a solid surface like the floor. The idea behind CPR is we want to be breathing for the patient and pumping the heart for them. This way we can deliver the oxygenated blood around the system whilst getting the animal to a veterinary practice to see a trained professional. You want to deliver some breaths. Now this, you can either just go straight onto the compressions, or if you feel confident and comfortable, you can deliver 5 rescue breaths first and close their mouth with both hands. You want to be delivering the breaths through their nostrils. So ideally, deliver 5 rescue breaths. I'll show you. Whilst you're delivering the breaths, you should be able to see the chest rising and falling. When you're delivering the breaths, you want to deliver them long and smooth. You want to see the lung fill. Rather than it's a like filling a balloon. In between each breath, move your mouth away from the nose to allow the air to leave. After the rescue breaths, then we move on to compressions. For your compressions, interlock your fingers. Make sure your elbows are locked out. You want your body weight over the top of the animal, so ideally if they're on the floor, you're going to be on your knees. You want to place the palm of your hand directly over their heart, so like I said earlier, pull their leg back and where their elbow lands is their heart. Palm there, interlock fingers. Lock your elbows out. A lot of people wonder how hard you have to press. This depends on the size of the dog. So you want to compress 1/3 of their chest depth. So on a Chihuahua or a cat, that would be much less than a Doberman or a Great Dane. You want to make sure that you are delivering enough pressure to compress and then pulling up enough to allow the heart to refill. You want to deliver 30 compressions. I'm probably not going to do 30 because this is not that kind of video. As you're doing it, you want to follow a rhythm in your head, like the song Staying Alive. 1, 2, 3, 4. Follow that rhythm. After the 30 compressions, then you deliver 2 more breaths. And this works in a circuit then. 2 breaths, 30 compressions, 2 breaths, 30 compressions. Every couple of minutes, you can keep stopping and doing a life check. Your life check only wants to take a couple of seconds. Have a quick feel. Can you feel a pulse? Is the animal breathing? No. Continue on with your compressions. Whilst you are doing this, you also need to phone the vets Let them know what is happening and start making your way down to the practice. CPR is also very, very tiring, and if you've been doing it for 10 minutes, you're a hero. Often what you can do is, there's a person giving breaths, if there's two people there, one giving breaths, the other doing compressions, and then you keep swapping. So one person is not getting too tired and the CPR is done effectively. Hopefully none of you need this information, but make sure to save the video just in case and you can keep refreshing your memory. This is also part of a mini-series, so I'm going to be covering other videos on what to do if your pet is choking, what to do if your pet has a seizure, and if there's anything else that you want to know, let me know. So make sure to follow my account and share this video with anybody that it could help. Love you all so much, keep your pet safe, bye bye. He's alive, it worked. You don't need to panic anymore, Wallace. When we gave him CPR, now he's fine. P.S. Not only am I a veterinary nurse, but I'm also trained to teach pet first aid courses. So if that would be of use to anybody, you would like me to start offering Zoom courses or in-person courses, just drop a comment down below and I shall let you know. Oh my god, I can't feel my ankles.